So good morning and welcome to Maryland Business Roundtable for Education. We are going to have the Healthcare as a Puzzle, Which Piece Are You program today. And I'd like to do things a little bit differently. Yesterday I was very nervous for some reason, and today I'd like to start a little differently. And I thought it'd be nice if we could introduce ourselves and tell each other where we're from, because we had a wide variety of places that we were from yesterday. And when the surgeon was talking, Dr. Kurtam, he was talking about people coming in and doing like little internships with him. And I don't think he realized that we were from all different places across the state. So Horachelle, I do realize that your mic isn't working, and I do know that your camera's not working. So if you want to put it in the chat, I'd be happy to relay your information. But if the rest of us, if your mic and your camera are working, if you can share that information, that would be fantastic. Can we start with you, Taisha?
Okay. Hi, my name is Taisha Johnson, and I'm from Kent County, Maryland.
Thank you. And how about Gracie?
Hi, my name's Gracie Doman, and I'm from Allegheny County, Maryland.
Thank you, Gracie. And Haley?
Hi, my name is Haley Llewellyn, and I'm also from Allegheny County.
Thank you. And Miss Jenna?
Good morning. My name is Jenna. I'm from Wacomico County.
Thank you very much. And Horachelle? I'm sure she's typing. Jordan? We can't hear you, Jordan. Is it not working? I did see that she put in the chat that she's from Allegheny County. And Horachelle says, hello, she's from Caroline County. So thank you all for joining us today. Do you have, I'm sure you're here because you're interested in things in the medical field. Would you like to share what part of the medical field you might be interested in? If you'd like to put it in the chat very quickly, I can share that. Jordan says she's very interested in nursing, so you would have had a nice time with that yesterday. Gracie's interested in surgery. Anybody else willing to share? Reconstructive surgery or orthodontics.
That's pretty cool.
Wow, very interesting. Anybody else? Doctor, but still trying to figure out which part I want to do. And there's so many choices when you want to become a doctor. So many choices. Well, hopefully while you're in this program, it will give you some ideas. Part of the program, though, was to talk about the different parts of working in a hospital. A lot of people think about going into healthcare and they don't know what they want to do. And a lot of people, when they think about healthcare, think about doctors and nurses. When I've talked to my students at school and I say, when you think about a hospital, what do you think about? And they say, doctors and nurses. Today, we're going to talk about some other things that go on in a hospital and some other occupations that go with a hospital. So today I'm going to turn it over to Janine, and I know she's in there listening, and we're going to start with something called environmental services. And Janine, if you wouldn't mind introducing your guest and what she's going to be talking about today.
Okay, so this is Paula Weaver, and she is a contractor at the hospital. So she works for Shore Contracting to make sure we have what we need when our patients need a bed. So they make sure everything's clean and sterilized and all kinds of good stuff. So she's gonna fill you guys in on it. Okay, so this is Miss Paula Weaver.
Good morning. Like Jeannie said, my name is Paula Weaver. I am, up until yesterday, the operations manager for the environmental services team. I have since moved into the director role, so I'm taking on a little bit, kind of move a little bit fast. I've only been in this position for about 2 years, so that can show you the difference in time frame that you can move up just a little bit there. And speaking of moving up, a lot of people look at environmental services and they think, well, I don't want to be a housekeeper. I don't want to clean, you know. I have a lot of people who go from housekeeping and they use our housekeeping program as a stepping stone while they're going through school, while they are trying to get their degree for nursing or to be a doctor or whatever else. They kind of get their foot in the door and see what a hospital environment looks like. And they get to know some of the staff in the building to use for references or to really see what it's going to look like on the inside when they get in. And they move from there. So it's kind of a bottom up sort of a thing. It's not something that a lot of people get into to do forever. There are some who enjoy it a whole lot and they stay in it. I have many staff members who've been at it for about 35 plus years. And they just love what they do and they continue to do that because they love the service that they provide. So what do we do as housekeeping? What is EVS, or environmental services? The company that I work for is called Crawford Healthcare Services. We are contracted, like Jeannie said. We provide a management service to bring a program of cleanliness for the hospital and for the staff in the hospital. What we do with that is we provide a cleaning. We provide a service for patient experience. So not only do we clean the hospital, but we also take care of the patient in the room in a way of having conversations with them, giving them someone to talk to, being that person who can get a message back to the nurse when the nurse is not able to be in the room at the time. We make sure that they're comfortable in their room, that they have a sounding board if that's someone they need. I have a lot of staff members that will get asked to just stay and talk because the patient doesn't really have anyone to talk to. So it's kind of like at home, maybe mom or dad or your guardian or whoever is, you know, that person who picks up things around the house and keeps it going. And you're like, well, man, where did my laundry go? That's great. It's in my drawers. It's very similar in the hospital. There's always a clean environment. There's always something done. And there's that person behind the scenes who gets it done. But they're also the person you can go to talk about your woes or just be there when you need them. So our housekeepers provide a lot of that for the patients that are in the building and for some of the staff as well. So I have a little bit of a video that talks a little bit about more of what we do and the importance of that in a hospital care setting. So we're gonna try to get that on the screen here and share that a little bit. Okay, so we're gonna share screen. Oh, who's disabled? Oh, let me see. Hey, Shelly, can you share the screen with me? I think it said I needed you to share it. Lori, is there any way you can share?
I think you share the screen.
Green button at the bottom.
Yeah, I did that, but it says host disabled participant screen sharing. I don't know why I said Shelly. I don't know. I thought I'm
Yeah.
Try again.
There we go.
There we go.
Awesome.
Yay, that's what
Okay.
happened to me too. It's okay.
Okay, then here and then share, right?
Yeah.
And then how do we get back once we're done? So get
Oh,
this big
You
screen.
have to say stop share. So when you're
Okay.
done, that's what I figured out yesterday.
Nice. Okay, and then we're just gonna play, and then they should be able to see this.
The environmental services mission is to provide extraordinary care to patients and families and customers. We're not just another main service. We are on the front line.
Infection control is just making sure that we are not carrying any disease over to patients.
I protect my patients with correct chemicals. We know how to clean and we know how to make everything safe because no one wants to get sick.
Like धेरै झन् धेरै बिरामी हुने चान्स हुन्छ अर्को कुरा हैन.
They must take that job very seriously
because we understand that we're dealing with life and death situations here.
No job we do in our department is a small task.
I clean it. You're real, yes.
Housekeeping is not necessarily a glamorous job. There are some awesome smells that go along with housekeeping.
We clean every accident that happened. If there is isolation room, we need to check the board first. I need to be careful with that one. Yeah, I feel safe because we have everything for protection.
A hospital can be a very intense place to work at. We deal with real people with real problems and real conditions. We are here to add not only a clean environment to those patients' rooms, but also to provide support to those patients. Some of our patients seek after our housekeepers.
There was a room that I was cleaning, and she was not satisfied with the way her room had been cleaned. So I went in and I deep cleaned for her. A few minutes later, the nurse called me back. She told me that she had requested that her room was cleaned again. And I was like, okay, of course. So I went back in and I re-cleaned it again. And I started talking with the woman, and it turns out she was just really lonely, and she just wanted someone to come and spend a little bit of time with her. And I was able to stay and talk with her and make sure that she felt that she received the care she needed.
I love my job. I love to help people. I like everybody here, especially I like my supervisor.
So well, our role as a management is to encourage our employees and educate our employees to let them know this is a career. Our job as a housekeeper is as important as one of the nurses, one of the doctors.
Housekeeping gives you so many opportunities to move and progress and improve.
I hope I will stay here also for many, many years.
An ideal candidate for me was someone who can be flexible and dependable.
Who is outgoing and very personable, but also someone who is willing to work hard and who isn't afraid to get in there and clean up.
We are heavily regulated. We have a lot of rules. We have a lot of conditions that we need to follow by. I'm not sure if everyone always really considers those.
You need to be willing to not only to learn, but also being able to help others.
Housekeepers have the opportunity to relate to their patients because they're on that front line. They're that blue collar workforce that is so relatable.
They're not in a rush. They says, what can I do for you? I had the time. So they like that. Patients like that.
I like to be a team worker. Everybody is nice, and I love to work in introverted.
Ultimately, I think what helps motivate people is when they recognize the difference that they can have in a patient's life. That provides a huge level of job satisfaction.
I know I'm making a difference. I make a difference on people's lives.
I love my job. I like that my patient getting every day better and better.
Yeah, that's so here. And then click stop share.
Yeah, you might want to have to stop. Just make sure.
Okay, let me get rid of it. Oh, there it goes. Okay, now we should be back to my right. Okay, so you're back.
So that spoke a lot about some of the nitty gritty of what we do. And then the patient care side of things and how important it is for us to be that advocate for the patient and how we can make a difference in their stay just by being a listening ear sometimes. On the other side of that, we do some other really cool things. We refinish floors, which you would not expect for a housekeeper to be able to do. But if we don't have nice shiny floors, then they're considered porous and they can carry diseases and infections in them just as well. So we sometimes will take the old finish off the top of the floor and we'll put some shiny new finish on top of there. That's a project that we're working on very, very frequently. It takes a lot of time, and a lot of times when you get done with one area, you got to come back and do it again. So we have what's called Tech 2s or project techs who are not just daily cleaners or housekeepers. They will come through and they'll work on things like that daily. So they'll do the harder things, the things that are a little bit more tedious, like stripping floors and waxing them. Those require a little bit extra training. So they're paid a little bit higher. And it's a lot harder work. So it's really cool to see that side of the housekeeping as well. Any questions? Does anybody have any questions for me?
I do.
Yes.
You had mentioned that some people will come in and use this as a stepping stone to become a nurse or another position in the hospital.
Mm-hmm.
Is there ever a time where maybe the hospital would help pay for the education if they were doing something like that?
Honestly, I'm not sure. That would be, yep, and Jeannie might actually be able to speak to that.
I can answer that. So like if you're going into nursing and other things, we do have scholarships, foundation money. You have to be here for at least a year, and then you're eligible. I got my bachelor's for $300. The hospital paid for the rest, and I got my master's in nursing education for $700, and the hospital paid for the rest. So,
So
like if you want to start out as a tech or go up to RN.
So that could be a good stepping stone. And my thoughts would be that if somebody was looking for a position in a hospital like that, being in that atmosphere could help them learn along the way as well.
Yes. Yeah. You get to hear the lingo, you get to, you know, start relating to the patients, you get to see all the stuff that goes on, and it kind of gets you acclimated to the atmosphere. So when you are ready to do something else, or there's so many people that just want to stay because they love it. I mean, there's been numerous housekeepers that have saved our patients from falling. They'll be walking by and go, "Oh, are you supposed to be out of bed?" And then they'll help get them back into bed and stuff. I mean, it's a lot. It's teamwork.
Again, which piece of the puzzle is somebody when it comes to working in the hospital?
Yeah.
Very nice. My experience has been, it will also help somebody decide if that's where they really want to be or not.
Yes, when you see the inside of things and
Exactly.
you get really down into it, you'll start to see, you know, okay, well, maybe that's not for me, or wow, that's really cool. I think I'll change what I was originally thinking I was going to do.
Exactly. Very nice. Well, I'd like to thank you very much for being with us today. Does anybody else have any questions that they would like to ask? It's okay if you type them. Well, if you think of any, you can always email me and I can share them with her and we can get answers for you.
Absolutely.
All right, awesome.
Thanks,
Oh,
guys.
wait, do you get to be close to patients like nurses?
Yes, every day. Every day. Our housekeepers are in every single patient room every day, sometimes 3 times a day.
Just as much as the nurse, if not more.
Yeah.
Very nice.
Actually,
Welcome.
a very important part of our program is making sure that we're in the patient room interacting with them regularly.
Very good. Did that answer that question? Does anybody else? Do you choose what area of the hospital you get to work in?
That depends on what you apply for. So if you want to be a floor tech, then that's, you know, basically just empty rooms. We don't try to be in refinishing floors in where the patients are. As far as in the rest of the hospital, most of our people are just regular AVS techs. So they kind of maneuver everywhere. It really just depends on comfort level. So I like to start people off just doing discharges so they know how to do the basic steps of clean, and integrate them into areas and then into patient areas once they get comfortable with what it is that they're doing.
And I'd like to add, this is a really, really important job of the hospital because it's so important not to leave any of the germs behind, especially in the time we're living in that people are ultra aware of the germs being around. This is so important to keep everything spick and span clean.
I will say that probably the most beneficial part of COVID for housekeeping has been that people have really recognized the role that housekeepers play.
Exactly, and how important it is.
Says this sounds fun and interesting.
Yes.
It can be very fun. Absolutely. We have a lot of good times.
Thank you very much for being with us today.
Not a problem. Thank you.
Thank you so much. I'm gonna steal my
Okay,
phone.
so from here, Janine, would you like to do the introductions?
Yep. So next we have, it's hard to talk through this thing. I'm so sorry. But we have Norm Washburn. He is our manager of IT. He is the IT guru for all over Shore, I think. Pretty much. Yeah, he's got us all covered. So anybody that's into computers, he is your man. So I'll turn it over to Norm.
Thank you, Janine.
Uh-huh.
Good morning, everybody. I'm going to start a presentation here to show you a little bit about IT. Can everyone see that? Can you all see the presentation?
I would say yes.
Yes.
Okay, good. All right, well, thank you for having me here today to speak. My name's Norm Washburn again, and I am the University of Maryland Shore Regional Health IT Department Technical Site Manager. I'm going to talk to you a little bit today about IT. So first of all, does everyone know what IT is? The definition of, I'm going to get out the, my friends tell me I'm showing my age when I talk about Webster. Most of you guys, I don't know if you know who Webster was, but we'll go with Wikipedia. The definition of information technology is the study or use of systems for data storage and retrieval and the sending of information. In the case of healthcare IT, the data is all of the information that is collected during a patient's stay or interaction with us and within our healthcare system. This data includes obvious things such as names, addresses, personal identification items such as date of birth, social security, insurance information, other financial information such as credit card info, and most importantly, all of the clinical documentation such as test results and orders, notes, surgical records, etc. But IT is so much more. For example, we recently developed a system whereby our patients and their families could leverage mobile devices such as phones and iPads to have virtual visits while they were our inpatient guests, and personal visits were prohibited due to the pandemic. We've also been involved in development of telehealth initiatives where you can have a virtual doctor visit with your physician via video teleconference. Telehealth is a wonderful way of providing access to regional medical specialists for rural and underserved areas. In the past, patients requiring access to these specialties would have had to have traveled to large urban areas and teaching institutions. When you work in IT, you'll have many choices of areas that you can specialize in. And as you gain experience, you'll cross over into many of these areas. And while you may not become an expert in all of them, you'll gain a much better understanding of how they all interrelate. I've included a very small list here of a few of these areas of specialization. End user support.
I'm not sure I understand.
Oh, my Apple Watch isn't sure she understands me. End user support. End user support consists of our help desk folks who support people. We call it at the elbow support. This would be for printers, PCs, people who are having software issues, things like that. Server administration. Well, each of our file servers, our email servers, our database servers, all of these devices need people to administer them on a daily basis. They will do such things as creating new accounts for people. If you come in as a new employee, you may need an email account. You may need access to certain directories or folders. They do all of that type of daily administration. Network support. The folks who do network support do the build outs and they support the hardware cabling, the wireless network infrastructure, all of the switches, routers, firewalls, etc. They handle all of those type activities. Oh, I think I skipped a slide. All right. Software support services. These are people who support the software, the applications folks. And they'll support that software through its complete life cycle, from conception all the way to its eventual retirement. Software changes frequently, and with it all, it's all finite. It's got a finite lifetime, and it changes as the needs change. Project management. When you're in IT and you get involved in projects, it's not just a one-person project. You will be actually interfacing with a lot of other teams, all the teams that I just mentioned, and then even more. Sometimes contractors, sometimes, for example, we're building out a new freestanding medical facility in Cambridge. We're involved in reviewing the blueprints, making sure that there are network drops in the correct locations for our end users. you get exposed to a lot of different teams, and somebody has to kind of ride herd and oversee all of that. And those are our project managers who keep that ball moving and organized and get everything done. Web development. If you go to a website, that was built by a web developer, someone who uses multiple different languages, programming platforms, and they create that HTML content. Again, programmers, people who build these applications. We don't have a lot of in-house programmers within UMS, but we purchase most of our software from outside vendors. But again, you know, they're programmers who develop all of this. The next part is called cybersecurity. I can tell you that is a really big and upcoming field. As you hear a lot about security breaches, credit card breaches, etc. Spying, trade secret, people stealing trade secrets, people trying to get into your accounts, phishing expeditions where they will try and get information from you to try and hack into your accounts and such. Cybersecurity are the people who defend us against that and keep our data safe. Let's see. I'll tell you a little bit about myself. I've been involved in the medical field for the last, I started when I was 10, so I've been in the field for 41 years. What you'll find in life is that a lot of people change careers. What you set out to do the day you leave high school isn't necessarily the job you'll be doing when you retire. So I can tell you that personally. I started working for Shore Regional Health back in 1985 as an X-ray and CAT scan tech. I worked in the radiology department. And then in 1992, I made a midlife career change into the IT world. So I've been doing this type of work for the last 28 years, okay? I've worked pretty hard to obtain several IT technical certifications that are recognized within the industry. This enabled my career progression to my current position as the manager of the end user computing team for UMMS UMS Shore Regional Health. Our local EUC team is part of a much larger corporate IT group. We provide the end user support to all of the end users of the IT equipment. Let's see, can you see? EUC team, that's the team that I manage. It's basically an abbreviation for end user computing. We provide all of the technical support to the end users, things involving hardware, like I mentioned earlier, the desktop PCs, all the laptops, iPads, printers. If it has a computer in it, we manage it. Our group overall, corporate-wide, we manage in excess of 20,000 PCs, thousands of printers, and we're spread throughout the state. On the shore here, we have a presence in 5 counties, so we don't get bored. We purchase, configure, deploy, and manage these devices through their entire life cycle. This includes keeping each of these devices safe and properly configured so that we can upgrade them with Microsoft patches as they get released. We keep current antivirus software on them and try and keep them all running so that they're there and present for our end users when they need them. We also work with our end users to determine whatever type of needs they have and can we solve them with technology. So, on top of that, we manage several thousand help desk tickets that come into us per year. And that's all done with a team of 5. I've got 1 person in Chestertown, 4 that work here in Easton, and we float to wherever we're needed. I've got people out on the road as we speak. Here's a little bit about the locations that we serve. Oops. This is Easton, East Shore Medical Center at Easton. This is our Shore Medical Center at Dorchester. This is in Dorchester County. It's our Cambridge facility. And this is our Chestertown facility. And this is our Queen Anne Emergency Department I guess it's Queenstown. And what's not in this picture is that big medical office building next door. That's part of our support area as well. So what's a day in the life like? Well, no 2 days are the same. It's fairly non-repetitive work. Like many jobs, it does require a lot of attention to details. It does require a commitment to lifelong learning as technology changes. Because of the fast pace of technology changes, many of the processes that we followed 5 years ago really are no longer relevant. Things change frequently. There are plenty of job opportunities because the work crosses over into so many different industries. It's not just IT healthcare. You can get jobs in industry, banking, finance, manufacturing, just it's endless. Travel work and telework is always an option for many people in this industry. Overall, it's been very rewarding profession for me. So how do you get an IT job? Well, first of all, go to college. I can't stress this enough. Seek to obtain a 4-year degree or higher in one of the computer science fields, okay? A degree is almost essential to even land you an interview, okay? When hiring a manager is looking to hire someone and you're one little resume in an inch-thick pile, you need to stand out among them to even score that first interview. So how do you stand out? Well, after obtaining your degree, study, take and pass some of those industry certifications that I mentioned earlier. This shows that you possess the necessary knowledge and that you can think on your feet under pressure. Let's talk a little bit about salaries. Salaries can vary widely, guys. Typical starting salaries for someone fresh out of school may start around $40,000 to $45,000. With additional years of experience and depending upon your area of specialization, like what I talked about back there, your role and the size of your organization, you can easily make a good 6-figure living, but don't expect this early on in your career. Here's a little advice, okay? I'll leave you with a few thoughts from me, and I'll tell you what I told my son. Much of what I'm going to tell you here applies to most professions and not just IT. The hardest job to land will be your first one, okay? Remember, you'll be coming out of school with very little real work experience. Typically, hiring managers want people with a lot of varied experiences. I like to call them jacks of all trades and maybe not masters of any. But the more experience you gather, the more valuable individual you are for hiring. Land that first job by separating yourself from the herd, okay? Stand out on a resume. Get yourself those first interviews. Practice interviewing. Dress and act like the professional you wish to become. Your first few jobs may not be your dream job, okay? When you get that first job, volunteer for everything. The more exposure you get to different technologies, the more you'll know and the more you'll gather in your repertoire of skills. This makes you a much more valuable resource, and your supervisors will soon learn that you're dependable and you'll become the go-to individual who they know can get things done. Over time, career advancement then becomes nearly inevitable as you rise to the occasion. Guys, that concludes my presentation for this morning. I'll entertain a few questions if there are any. My email address is on the bottom of this slide. If I can advise you or answer any questions that you think of later, I'd be happy to. And thank you for your time and for having me again. Thank you. Questions?
I would like to start by saying thank you very much. And I've already had one request to know if I could share your slides with them through email that they could go back and read through them again.
Absolutely. Yep.
Will you be able to send those to me?
I sure will.
And I also know that we are recording this to share through a YouTube video as well, but I think they would like to take the time and look at them again.
Absolutely.
And sage advice, volunteering for everything, hardest job is your first one. We tell our students that quite often.
Yep. Yep.
Do you find, now we said healthcare is a puzzle, which piece are you? Do you find having any background in the health field has helped you in IT? Do you find that knowing anything about the healthcare field has helped you in this position?
Absolutely, because I can identify when these requests come in from clinical areas. A lot of times the folks that work for me will scratch their heads and try and understand why they might ask for something. And it takes me back to the days when, I was in the trenches, and I remember, oh, okay, I understand now because they're doing X or they're, whatever. It makes a lot more sense to me, and it does help me a lot. It also, how can I say this? A lot of folks are intimidated by really smart people like surgeons and doctors and stuff. And when you have a one-on-one relationship, you used to work side by side with them, it helps a lot. And you can work on a one-to-one basis with them and not be afraid to speak your mind. And it's just helped me a lot.
We had a question from Jordan that says, do you work with the doctors and nurses to help them with their computer stuff?
Absolutely, every day.
What I'm also finding is that when you go to a doctor's office anymore, they are not writing in paper charts from back in the day.
That's correct. Yep.
I'm a little older.
Yep.
And they are actually typing things on the computer. So if somebody is choosing to go into a healthcare field, they are going to have some knowledge of how to work a computer, if you will.
That's true. The days back when we were, am I still sharing? I need to turn that off probably, don't I? I'm sorry. I didn't realize I was still sharing. Absolutely. The days when people would come in and kind of learn on the job, a lot of our end users, I'm dating myself here, but they were not real PC proficient, shall we say, when I first started. And now I have users that come in that are nearly as proficient as us. I've got a new VP who is very, very progressive, and he has me scratching my head a few times with challenges, IT challenges. But you almost anything any career you guys are going to get into, you're going to want to have some PC proficiency. And clearly, I think you guys have a leg up on a lot of us. When I came up in school, quite frankly, we didn't have personal PCs until after I got out of school. My son, and he'll be speaking tomorrow, by the way. He's as comfortable with it as it was an Xbox. It's a different generational thing.
The question from Gracie is, so you handle the charts and all the medical info through IT?
Yes. Everything, like on that one slide that I showed, anything that's part of the patient record, whether it be financial data, clinical results, lab results, radiology results, physician notes, surgical notes. If it involves that patient, we're storing it. We're responsible for that data to keep it safe and keep it. If you have a child that's born, we have to keep the records until that child's 18, and we keep them long after that. If you had a broken ankle back in 1960, we probably have the records that were created.
And Courtney wants to know how you were able to keep it private. How do you keep all that information private?
We have special, University of Maryland has a security team And we do not allow, you can't just come in and, you know, plug your PC into one of our jacks and jump on our network. You have to go through a lot of, you know, fact-checking, testing. You got to make sure that you're running current antivirus software and such. We work with a lot of vendors. We have a lot of intrusion prevention application software that scans for incoming what we call phishing emails and such. It's become very, very advanced from where we were even 10 or 15 years ago. It's mind-boggling, the things that we were attacked a few years back, and thank God they didn't get anything. But healthcare, if you read the trade rags, healthcare is a real target for intrusion from some bad actors.
I would say it's similar to high schools and how our school systems only having computers go through their servers to keep their computers and knowledge safe as well.
Yep. And somewhere behind the scenes, there's some IT guy who made those decisions.
Exactly.
Right.
Well, Mr. Washburn, I want to thank you for your time today.
My pleasure.
If the students have any other questions, I'm sure they can send them to me and I'll get them to you.
Very good. Thank you, guys. Thank you for your time.
Janine, I think we have one more guest today. Would you like to introduce her for us, please? You're muted.
Okay, I think I'm unmuted and I'm unmasked. So this is Dr. Melissa Means. She is a PharmD with University of Maryland Shore Regional Health, and she helps us with pharmacy questions, making sure patients get the right meds. It's just a whole bunch of stuff that she does to help keep patients safe and also to help nurses stay sane. So Miss Melissa Means.
Hello, everyone. My name, like Janine introduced me, is Melissa Means. I'm one of the clinical pharmacists at Shore Regional Health. And I started out down at the Dorchester Hospital, so the hospital down in Cambridge, and have kind of adjusted positions throughout my career. But give me 1 second, I'll share my screen and jump right in. Let's see. Sorry, 1 second. Okay, so today I am going to be introducing you all to the world of hospital pharmacy. So I'm sure a lot of you do know your quote unquote local pharmacist. So your pharmacist that is in your local store, whether it be a CVS, a Rite Aid, a Walmart, or an independent pharmacy around here like Hills or Craig's. But there are pharmacists throughout the hospital in various different careers that, for the most part, we do work behind the scenes. So most patients aren't really going to see the pharmacist, but we are in a lot of contact with the nurses and the physicians, making sure that all the patients are getting the medications that they do need when they need it, and the appropriate medications at that fact. So first, let me talk to you about some important skills that I feel if someone's going into pharmacy is a great thing to have to both get you through schooling as well as to make sure that your career is as successful as possible. So first, having some strengths both in biology and chemistry are very important to help learn both how the body works and whenever something goes wrong, understanding what in the body is going wrong and what medications can be used to help fix that problem. And then the chemistry aspect, to be able to understand how medications are made, how they're tweaked a little bit to make them more effective or possibly make your body tolerate it and possibly have some lower side effects as well. Those are all great things to have. Will definitely help you get through schooling, but then also into your career, understand what all's going on. Having some proficiency in math also is definitely very helpful. Helps to get the right doses a lot of times and to help just check everything, all the math going on behind dosing and administration rates for IVs. Being detail oriented is definitely a priority in pharmacy. A lot of our work is checking a lot of the little details, whether it be the prescription order, making sure someone's labs look appropriate for the medication you're using, making sure their vital signs, so their blood pressures, their heart rates, things like that, making sure those all look good. And just being able to make sure you're checking all those little boxes before you allow medication to get to a patient. Being able to multitask. This is probably all of healthcare in general, being able to multitask throughout your day. And this is for any pharmacy that you would be in. If you're in a pharmacy, the phone is ringing off the hook all day long with calls from patients, or in the hospital from nurses and doctors, trying to figure out what the heck is going on, what they need to be using. And then on top of that, making sure you're checking all the medications that need to get out of the pharmacy and checking all the prescriptions that are coming into the pharmacy. So being able to do a lot of things at once will definitely help you in pharmacy. Also, quickly being able to prioritize new work. And this could also be reprioritizing throughout the day. In the hospital, you have patients who either come into the hospital and are very critically ill, or are already at the hospital and just aren't getting better. So being able to prioritize what you need to do to make sure those patients are getting the care that they need is always a good thing. And then the last one is also, for the most part, for all of healthcare, but being able to communicate efficiently will drastically change your day. So being able to figure out what someone's calling to ask for, or trying to communicate what you're trying to fix to someone else is always important. And to be able to do that effectively will make your day, of course, go much smoother. So the types of pharmacists that you will see in the hospital, this is just a short list. Depending on what your hospital you are at, it can be a much longer list. But for the most part, every hospital does have some staff pharmacists. They're the pharmacists that are in the pharmacy in the hospital the most often. You're also going to have some clinical pharmacists, and those pharmacists a lot of times are up on the floors working directly with the nurses and the physicians. And then you do have, similar to what Norm was talking about, some information technology pharmacists. And then of course, like every department, you have your managers, and in the pharmacy, those do all have to be pharmacists, and those can be someone from an operations manager that makes sure everything happening in the pharmacy is going smoothly, making sure that they're putting things in place to help people get their job done, as well as making sure that we are following all the laws that are out there to make us run safely. And then you do have your directors who help make sure everything is running smoothly amongst the other departments within the hospital. I won't focus as much on the management. I haven't been in those positions, so I can't speak to them personally. So first, we'll talk about the staff pharmacists. So like I said, those are the pharmacists that are generally in the pharmacy, and they are responsible for verifying every prescription that is written within the hospital. Whether it be a patient that is in the ER and is only going to be there for a few hours and then go home, or if it is a patient that is in the hospital and will be there for several days. So when they're checking a prescription, they make sure it's being given the correct way, so either by mouth or by an IV, so that's going directly into your veins, making sure that they're getting the appropriate dose, as well as getting it at the appropriate frequency for that medication. And then when patients do come to the hospital, sometimes their bodies aren't quite working like they would normally be. Your kidneys may not be as efficient as normal, or your liver is out of whack. And so we make sure that all the doses are appropriate for what's going on with the body. And that's reevaluated throughout the hospital stay as well. These pharmacists also do check every single medication before it leaves the pharmacy as well. So they make sure a drug that is going directly to a nurse to be given to the patient is the correct medication. If it's in an IV, make sure it's in the correct fluid. so that nothing happens with that. And then we also do send medications to dispensing cabinets. A lot of people will hear them called Pyxis units, but there are other brands out there. So those dispensing cabinets are there for the nurses to be able to pull the medication whenever it is appropriate for that patient. So it's something that isn't necessarily going to be needed now, but may be needed in a day or two. And it's just easier to have it up there. That way people don't have to wait for the pharmacy to deliver it. And they are also available for any questions anyone throughout the hospital does have. The most common questions, not an extensive list, but the most common ones that we get are, where is my medication? So trying to figure out where the heck the medication could have gotten to, or leading them to where it is actually located at. And then how certain medications are given. So sometimes when people are in the hospital, they can't take things via their mouth. So we help to figure out any other ways that we can get it into the patient. And then also side effects to medications. So it may be a side effect of a new medication that we started in the hospital, or potentially if we're worried that the reason they came to the hospital is possibly a side effect to medication. So it could be a medication that they were on before the hospital. Now, next we have clinical pharmacists. And these pharmacists are people who are generally up on the floors, and we work more directly with the nurses and the physicians. And our primary goal would be to evaluate a patient, all of their current disease states, make sure they are getting the correct medications for that disease state, as well as for how their body is currently functioning, and make sure they're on everything they should be on. And then obviously get rid of ones that they shouldn't be on at the current time. We also are able to follow certain medications when the physicians ask us to, and we are able to adjust those medications throughout the hospital stay to make sure that they are on the correct dose for what we're treating and how their body's currently working. And there are certain medications that you do dose based on the level of the medication within the body. So we're also following some of those. Some can be a little trickier and take a little more time to monitor. So that's why we're doing that. We are in charge of reviewing our hospital formulary. So if you're not familiar, the hospital formulary is the set of medications that the hospital carries. And so what we're doing is we, multiple things, but the two most important are we do review the current medications on our formulary, make sure everything is being used appropriately, and possibly identify areas that the medication isn't being used appropriately and see what we can do to help it be used whenever it is needed. We also review new medications out there and see if we should be carrying them, if it could be an added benefit to our patients. And then we also tend to work in clinics for patients that aren't necessarily directly in the hospital, but are at home. Some examples, not just that Shore Regional Health has, but examples that a lot of different hospitals have, are antithrombosis clinics, or more commonly called Coumadin clinics, diabetes clinics, and transplant clinics, just to name a few. There are many more out there as well. And then lastly is the information technology pharmacist. A lot of people don't know that this exists, but they are out there and they are vitally useful to the pharmacy. So what they're doing is they actually help to build the dictionary of medications in the electronic medical record, and then they're able to tailor it specifically to the current hospital and their specific needs. So they help make what we call order sets. So a set of orders that we use for different disease states and just tailor it to what we find to be the most useful for our patient population. They're also in charge of updating the electronic medical record. So medications do get back ordered from time to time, and they're in charge of building some things in there to help everyone know that something's back ordered and give recommendations for what should be used. They're also in charge of adding new medications to the hospital formulary and into the computer. And if any workflows are changed throughout the hospital, especially that deal with medications, they are in charge of making sure that all does go smoothly. They keep all our pricing up to date in the computer That way we know that the patients are being charged correctly, and they do review any errors that are going on in the background in the system and try to correct those or take whatever steps they can to help correct them. And lastly, what does it take to actually become a pharmacist? So on average, it does, from after high school, it does take about 6 to 8 years. And some of that depends on which path you take. The first 2 school types that are listed here are a schooling type that you basically go directly into pharmacy school. The first is a 0-6 program, and that is a program that you're actually admitted directly into the pharmacy school. You have to keep a certain GPA throughout the program, but then you do end up with your doctorate of pharmacy at the end. The second is called a 2-4 program. So the first 2 years of your schooling, you're in a pre-pharmacy school. You have to then reapply after those 2 years, keep a certain GPA, take a certain exam to show what all you have learned. And then the last 4 years are just your pharmacy program. And at the end of that, you do end up with the doctorate of pharmacy as well. Now, the second 2 types of school programs, these would be after you already have an undergraduate degree. So they do take a little bit longer to get the full undergraduate degree. And a lot of times, if someone's going to take this route, we would encourage a biology or chemistry degree. But as long as you get whatever prerequisites the pharmacy school requires, it would qualify. And so this can be either a 4-year program or a 3-year accelerated program. The difference is the 3-year program is just going to school all year round. So the 4-year, you have summer off like usual. 3 years are everything compacted, including the summers. So if you enjoy going to school constantly, you definitely can do that. And then lastly, and it is not required for a pharmacy degree, but there are postgraduate residencies out there. And those are for people who are very interested in any certain field, so whether it be maybe pediatrics, toxicology, things like that. They are available out there. They are not a requirement to working in pharmacy, but if you have a certain love for something, they are there. So what questions does everyone have now? Let me stop my share. Oh, I think you're still on mute.
I like to give them a moment to process.
It's a lot of information.
What I find interesting is that it is a full doctor degree.
It is. So whether someone goes a 6-year route or an 8-year route, and that 8-year can be extended over time. Some people do go back midlife and decide, you know, I want to be a pharmacist. Mm-hmm. And that is a definite possibility. And you do end up with a doctorate at the end of it all, which is great.
How do you ensure that patient, finish it, Courtney. Jordan, we'll come back to Courtney's. Jordan would like to know how many years you went to school and where you went to school.
So I went to let me start. I grew up in Western Pennsylvania, and I actually went to school at Ohio Northern University. I did do a 0-6 program. So in high school, I knew I wanted to be in pharmacy, and if possible, I wanted to be able to go right into pharmacy school. So I did get into a 0-6 program. I only went for 6 years. I did not do a residency. Instead, I did some time as a staff pharmacist, got some experience, and became a clinical pharmacist. And yeah.
I have to ask, where in Western Pennsylvania did you grow up?
I grew up in Punxsutawney, Pennsylvania.
Punxsutawneyville.
Yes, exactly. Very tiny town.
Girl, I'm familiar.
Okay. Where did you grow up?
I went to Still Valley High School.
Okay.
So right near Kennywood Park.
Yeah.
So doing the post-grad residency allows you to see a specialization you might prefer as a pharmacist?
Correct. So it is a residency that you are actually working directly with pharmacists that are practicing. in whatever field it may be. So whether it be oncology, you're going to be learning from a pharmacist who has been working as an oncology pharmacist. You know.
And Courtney followed up with, I meant to say, how do you ensure that patients don't overdose on their medication?
So we don't have as much control whenever they're at home. Of course, patients can only get certain amounts of supplies, but whenever they are in the hospital, we only allow them to take medications that are from the hospital. And that way they're not taking their home medications in addition to what we are providing. We also, we follow their labs very, very closely. That way it does make sure that over time, too much of the medication doesn't build up in their system. We have defaults in the computer that do warn people whenever they are ordering too much of a medication and say, whoa, 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 let's rethink this. So we have some defaults, and then the pharmacists, part of our training is to learn normal doses of a medication and when those normal doses may not be appropriate. So when we're verifying the doses that the providers are entering, we do identify whenever a dose is too high and make an intervention, call the provider, see what they're trying to do, and give them recommendations about where they should go.
Well, I would like to thank you very much for being with us. We've gone a little over our time. I did have a request for you as well, if you could share your PowerPoint with me, because they would like to look at it on their time as well. Many of them are looking on their phones, so they'd like to go back and be able to zoom in a little more. I would like to thank you for your time, for your information. Everybody, if you do have any follow-up questions, if you email me, I'd be happy to send them the questions and get you your answers. I hope you will come back and join me tomorrow. We're going to be talking about biomedical technology, the profession of nursing practices, and then I have a very special treat for you tomorrow. We have a captain from the military with the Judge Advocate Generals. I know this is something that wasn't planned, but it's a very special treat, and I know you're going to like it. While it's not exactly with healthcare, it's something you probably weren't expecting, and it is very special. We're very lucky to have this person joining us. So until tomorrow, have a wonderful day and be safe out there.